Good morning and welcome to this channel again. This is Mentor 8101. I'm trying to respond to some questions I've received on this channel, and I've tried to get some experts to actually help me because it's a topic that everybody's interested in. It's called autistic disorder spectrum. Autistic disorder spectrum is a spectrum, as I would say. Is it's a disorder. For the fact that people are born with it, and it's a disorder that comes from birth, and they said is related to brain development. Many autistic features are not seen until the child behavior develops. So we probably won't see it until the child is about 1 or 2 years old. The spectrum, the presentation in the spectrum is actually categorized in two main areas of their life. And this involves like difficulty with social communication and some restrictive, repetitive behavior that is odd when people look at it. It's a spectrum. For one thing, is serious and less serious, mild to severe, from one end to the other. Most of the questions I get is that, especially in the African community, people ask, is it because the parents have done something bad? I would say no to that. And some people have asked me a question, is it drug related? Is it because the mother during pregnancy was using some drugs? There have been no clear correlation between drug addiction or drug misuse and autism. So there's still a lot of research going on for us to have clear-cut causes, or what they call etiology, of autism. But we can say it's more rampant than we've known in the past. Some people will say maybe in Africa settings and in mental health settings in Africa, it was not those days maybe it was not easily recognized. I will ask you to look at your cousins in those days, look at other children, your peers, your mates. Do you see any of that trait in them? From my experience, I would say no. I didn't see many like we are seeing nowadays. Okay, so there must be a strong link with the present day things, which we are not sure about yet. But it's not because of the bad behavior of the mother. It's not because of bad luck of the mother. And there are a lot of services now available to people with autistic disorder. So do not be shy to ask for help when you are looking at your child and you are thinking something is odd. There are different things you could observe in their behavior. Some of them are self-preserved. They only relate with objects and all that. They interpret the environment wrongly, and that's why sometimes they show frustration and throw things around and throw tantrums. Some are just happy just being by themselves. They could sit by themselves. If they are not disturbed, they cause no problem. Some are very brilliant. This on the same spectrum, that they self-taught themselves about a lot of things. I've met an individual that was from completely different background, never been to Japan, never studied Japanese, and he self-taught himself. He became a Japanese interpreter, and he's never visited Japan. So you find some of them, it might be instruments, they learn a particular instrument and they play it extremely well. So it's a spectrum, and you have some at the far end that they cannot control themselves, they're very impulsive and all that, and then they become problematic. So we have so many presentation in autistic spectrum. So ask more questions. I will try to get some expert. I know many mental health practitioners that this is their area of practice. So share this with your friends and families. Let them ask questions, and we will get some experts to deal with them. Thank you. If you have not subscribed to this channel, this is another opportunity. Please go ahead and subscribe. Have a wonderful day, and God bless you all.